Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, my name is Yasmin Sofia binti Luqman. My metric number is D20231108-603. My lecturer name is Dr. Raibah Yazani binti Tengah. The body part that I choose is reproductive system, which is the female part. My project title is a deep dive into the female reproductive system. So today, we will learn about the disease, injury, aging and disorder of female reproductive system. Let's go to the introduction. What is the female reproductive system? The female reproductive system is the body part that help women or people assign female at birth, which is having sexual intercourse, reproduce and menstruate. There are 5 main components in female reproductive system, such as uterus, fallopian tube, ovary, cervix and vagina. Moving to the next point, there are many functions of female reproductive system. Firstly, it can produce eggs. The ovaries produce eggs and release eggs during the menstrual cycle. Other than that, the function of female reproductive system is fertilization. This female reproductive system allows for the union of a sperm cell from the male with an egg cell from the female. This process usually happens in the fallopian tubes. Next, the female reproductive system can produce hormones. The ovaries produce hormones such as estrogen and progesterone. Lastly, the function of female reproductive system is pregnancy support. The uterus provides a supportive environment for the developing embryo and fetus during pregnancy. So now, I would like to share with you what are the diseases of female reproductive system. The disease that I choose is ovarian cancer. Do you know what is the ovarian cancer? The ovarian cancer refers to the uncontrolled growth of abnormal cells in one or both ovaries. There are 4 mechanisms of ovarian cancer, such as family history, age, reproductive factors, and hormonal factors. The treatment for ovarian cancer are debulking surgery and chemotherapy. Debulking surgery is the main surgical procedure for ovarian cancer. In addition, chemotherapy is often used after surgery to kill any remaining cancer cells. So, we go to the rehabilitation for women who had ovarian cancer, physical rehabilitation and nutritional support. In physical rehabilitation, the patient can join any exercise program to improving strength, flexibility and fitness. The patient also can get the dietary counseling for nutritional support, so they can know what are the best way to ensure their body stay healthy. So this is the difference of normal ovary and cancerous. On the other hand, we will discuss what are the injury of female reproductive system. The injury is uterine inversion. Uterine inversion is a rare and potentially serious medical condition that occurs when the uterus turns inside out, either partially or completely. So, the mechanism of the uterine inversion are rapid delivery of placenta, uterine atony, abnormal placental adherence, and multiparty. The treatment for uterine inversion are surgery and uterine massage. If the manual repositioning is not successful, a surgical procedure may be necessary to correct the inversion. So, once the uterus is repositioned, massage of the uterine fundus is often performed to stimulate contractions and promote uterine tone. There are 2 rehabilitation to avoid the injury. The first one is physical recovery, like pelvic floor exercise and monitoring and follow up the appointment. Secondly is emotional support like counseling. Next, we go through about aging part, which is vaginal atrophy. So, The vaginal atrophy is a condition characterized by the thinning, drying, and inflammation of the vaginal walls. The mechanism of the injury are thinning of vaginal epithelium, decreased blood flow, decreased lubrication, and changes in pH levels. We can treat the injury by hormone replacement therapy and prescription medication. Hormone replacement therapy involves the use of estrogen to replace the hormones. There are two rehabilitation for who had the vaginal atrophy. Firstly, nutritional support. A balanced and nutritious diet contributes to overall health, including vaginal health. The second one is diet and lifestyle changes. Adopting a healthy lifestyle, including a balanced diet, can contribute to overall well-being, including vaginal health. The second one is diet and lifestyle changes. Adopting a healthy lifestyle, including a balanced diet, can contribute to overall well-being, including vaginal health. Last but not least, the disorder for female reproductive system is cervical dysplasia. Cervical dysplasia refers to abnormal changes in the cells of cervix. If untreated, cervical dysplasia can progress to cervical cancer. So, what is the name of injury for cervical dysplasia? The cervical dysplasia itself is not an injury. It is a term used to describe abnormal precancerous changes in the cells of the cervix. The treatment that we can do are laser therapy and loop electrosurgical excision procedure, LEEP. What is LEEP? LEEP is a procedure that uses a thin wire loop and an electrical current to remove the abnormal cervical tissue. In addition, the rehabilitation for cervical dysplasia are vaccination against HPV and regular follow-up and monitoring. To conclude, the human reproductive system is an example of sexual reproduction involving reproductive organs of male and female. Here are the references that I use to get the details information about female reproductive system. That's all from me. Thank you for your attention.